Hello, and welcome to The Voice of the Washington Monthly, your source for policy, politics, and fresh ideas. I'm your host, Ann Kim.
And I'm your co-host, Garrett Epps.
In this episode, the GOP assault on veterans' health care.
You know, they spend millions every year trying to trash the VA, not just the Kochs, but Rupert Murdoch and Fox News. So you have this dreadful picture of a really successful healthcare system that, yes, has some problems, but these problems are never compared to the private sector.
Today's guests are Suzanne Gordon and Steve Early. They're among the nation's foremost experts on the VA health system. They're also frequent contributors to the Washington Monthly. They will explain the Koch brothers' long-running plot to take down the VA health system. So Suzanne and Steve, welcome.
Thank you for having us.
Good to be here.
Now, Suzanne and Steve, you're both experts on the VA health system, but most Americans are not. So if we could start by you guys just giving us some very quick, basic facts on the VA and why it is so important to veterans.
Well, the Veterans Health Administration, which is the healthcare system run by the Department of Veterans Affairs, is the largest healthcare system in the United States, the only publicly funded national health system. It serves about 9 million veterans of America's 19 million. You have to have a service-connected disability and or be indigent or poor to get in, or have served in combat zones post 9/11. And it also teaches 70% of American physicians in training, most American psychologists, nurses. It is the second biggest research powerhouse in the U.S. after the National Institutes of Health. And it also has a fourth mission to respond to regional, local, and national emergencies like the COVID-19 pandemic, wildfires, volcano eruptions, hurricanes, etc. So it's a system that serves the nation's veterans, but really the entire nation, which is something that people just don't understand.
Well, you know, if you are a casual consumer of media, you might get a very different impression of the VA than the one you have given us, which is fascinating in its extent, and I certainly didn't realize fully. But, you know, we hear there's long waiting times and healthcare is rationing and our veterans are suffering. And can you address a little bit the criticisms that have been directed at the VA over the last 5 or 6 years?
Well, it's really over more than a decade, thank you, the dark money funded Koch Network of foundations and phony veterans organization. This has been a carefully constructed image, and they spend millions every year trying to trash the VA. And obviously, it's an enormous healthcare system, so there are going to be problems. But they completely ignore the data that shows that wait times in the VA are way lower than the private sector. I mean, just to give you one example, if a veteran goes with an emergency to a non-VA hospital rather than a VA hospital because the ambulance takes him there, he's twice as likely to die in the first 28 days in the non-VA hospital. In a private sector hospital, that's never reported in the media. I mean, they've really succeeded at trashing the VA. I mean, the tragedy is, and we've done an article in the Washington Monthly about this, is that most reporters who cover veterans issues don't know anything about healthcare. And most healthcare reporters don't know anything about the VA.
Veterans, yeah.
And so you have people who don't know what they're doing, basically, publishing press releases. And so you get bad information. You have editors that don't challenge the facts because they don't know what the facts are. And so they can't be very helpful. And you have, an enormous empire of money trying to trash, not just the Kochs, but Rupert Murdoch and Fox News, and then you have, a sort of mainstream media that is not much better. And so you have this dreadful picture of a really successful healthcare system that, yes, has some problems, but these problems are never compared to the private sector, to the problems that those of us who are cared for in the private sector have.
Right. So let's turn for a second to what the conservatives say that they want. And their main strategy has been to call for privatization, and they make it sound good, more choice, but what does this mean exactly? And what is it that they're arguing that privatization would somehow improve things?
Well, they're selling veterans a bill of goods. They're peddling a fantasy that you can have your cake and eat it too, that you can have this healthcare system dedicated to veterans with 300,000 employees, a budget of more than $100 billion a year. And you can also go anywhere you want, see any private doctor, be treated in any private hospital, and then send the bill to the VA. And they'll reimburse these outside providers. I mean, that is the Republican vision of choice. And a lot of corporate Dems have bought into it, too, over the years. The problem with that is it's not a successful business model for any healthcare system. We live out here in Northern California where an equivalent size healthcare system operates. It's called Kaiser. How long would Kaiser remain in business if 30 to 40% of its annual direct care budget was diverted to reimbursing all of its regional rivals? Stanford, UCSF, Sutter, and any Kaiser patient like me could go anywhere I want to get any kind of treatment and then send the bill to Kaiser. Kaiser's network of doctors and clinics and medical practices, its great staff, it would fall apart. They would start laying people off. They would start closing facilities because you can't sustain a network if everybody is allowed to go outside the network. Now, that is the grim reality that the VA is facing after a disastrous and costly 10-year experiment with outsourcing. And we're about to see a third wave of it. It started under Obama, continued under Trump, continued under Biden, and now we're back
in fourth wave
to Trump. So it's going to be the fourth wave. And the Republicans in Congress next year are really going to open the floodgates of outsourcing, and it's going to bankrupt the system, as experts have warned the Biden administration for 4 years, which failed to reverse the course of privatization.
And I would add that what's increasingly happening is this have your cake and eat it myth is really being abandoned. And now they're really very explicitly just saying, no, we're going to take the VA as a choice away. And there's some bills in Congress right now, for example, where basically if you sign up for private sector care, you literally can't go to the VA. So it's pretty interesting that, and I think that...
And it very much parallels, the much bigger impact of privatization on 65 million of us covered by, or we used to be covered by traditional Medicare, right? I mean, you got Medicare Advantage plans siphoning off hundreds, many billions of dollars a year unnecessarily, and more than half the seniors covered by them, same private interests, are feeding at the trough of VA outsourcing, affecting a smaller number of people. But it's a similar phenomenon, and it was not reversed. Medicare privatization under Biden, he had 4 years to clamp down on that. And so, with Dr. Oz in charge of the Centers for Medicare and Medicaid, that, it's going to be the pedal to the metal on that front as well. So there's a parallel privatization threat that really undermines the whole concept of public provision, the hated government healthcare systems that actually are really essential to millions of people who are poor and working class and older and disabled.
And also delivers the best care anywhere, as Phil Longman from the Washington Monthly wrote over a decade ago. I mean, the irony is that that Americans have, spent billions, if not maybe trillions of dollars over the past, century, building a specialized healthcare system for veterans. And it actually is better than most Americans, enjoy themselves. I mean, I'll give you one example. I have a friend who is a doctor in a VA hospital and is a non-veteran, so she can't get care in her old hospital. She can't get an appointment in the private sector for 4 months. She would have gotten an appointment in the VA if she were covered by the VA in 2 weeks. And you can, 8 months for a dermatology appointment in the private sector, a month in the VA at worst. And so it's just incredible. I mean, I listen to the news and I'm driving and I'm thinking, am I inhabiting a parallel universe? Because they just don't know, or they don't care.
You write in your article that we're in a situation now where the Trump administration wants Pete Hegseth to take over DOD, and he's got a track record of involvement in these issues and involvement in a group called Concerned Veterans for America, which is clearly a player. Could you tell us a little bit about that and the history of it?
Well, Concerned Veterans for America was basically set up with Koch brothers' money. Hegseth had a rather controversial 3 or 4 year tenure as its CEO. It's come out now that his performance was not the greatest as a boss, and he was pushed out. But he was an effective public spokesperson for that group 10 years ago, when it was really a right-wing kind of propaganda vehicle for opposing the Affordable Care Act, for promoting this idea of VA privatization, really displaying, libertarian hostility, again, to government health care in any form. If he becomes Pentagon chief, defense secretary, there's going to be lots of bigger things to worry about, I'm sure. But he is going to be in charge of what's probably the second largest public health care system in the U.S. after the VA, which is the military health system. And he's pretty much on record that the military should not be running hospitals and clinics and serving soldiers and their families and retirees from the military directly, and all of that care should be outsourced, which would be a tremendous upheaval in the healthcare coverage of hundreds of thousands of people who signed up for the military with assurances from military recruiters that they were going to get decent healthcare on the job, and later, when they left, they were going to get VA care. So, he's going to be well positioned to help betray two promises that have been made to many men and women when they were young, when they signed up and thought they were going to get GI Bill benefits and good health care and job training, a lot of other things in the military that sometimes people get, sometimes they don't, or pay a high price for getting it.
Well, and also what's really interesting is the military over the past decade, to save money, has actually cut the military health system and in-house care and sent people to TRICARE, which is the private sector insurance plan that covers military active duty service members and their families and retirees. And the DOD discovered that this isn't working, and it's really impacting their ability to have a healthy, deployable, force, and hurting national security. And so they decided to reverse this policy and bring people back into the military health system and rebuild it. And so Hegseth, and they have a whole plan for this, and Hegseth would be overseeing this, and he probably would reverse the reversal, which would be very bad, not only, for people's health and well-being, but also for the nation's ability to maintain a service-ready, combat-ready force.
So I spent a couple minutes on the Concerned Veterans for America website and saw a lot of references to the Mission Act.
Yes.
Can you explain what that was?
Yeah.
What that is?
Sure. The Mission Act was a signature Trump legislation that was passed in 2018, tragically, with a lot of Democratic support. And it set up a parallel private sector healthcare system from the VA called the Veterans Community Care Program. And veterans who had to drive what they deemed to be too long and wait what they deemed to be too long. I'm not going to go into the weeds because we don't have time. Were eligible for Mission Act. It was really never designed by legislators, except for the far right, to supplant the VA. It was supposed to supplement the VA care. And in fact, it's done the opposite, mostly because Trump's VA Secretary, Robert Wilkie, set up these eligibility standards that guaranteed a lot of outsourcing.
Well, you talk about the assault that's going to come. Do you have any idea what's coming down the legislative pike from the new administration
Yeah,
and
well,
what we
they're
need to
right
be aware of?
now they will be having a hearing in the House Committee for Veterans Affairs on a whole series of bills that are a preview of coming attractions. It's an interesting hodgepodge of completely incoherent and irrational policymaking, so characteristic of hard right Republicans. But it basically will allow any veteran, it eliminates these drive time and wait time eligibility criteria from the military, from the Mission Act, and basically says any vet can go anywhere with no utilization review from what will be our new insurance provider, the VA. That's completely unique in American healthcare, no utilization review. And they can go anywhere for any amount of time to get any service in the private sector. There's some bills like that would basically not allow veterans to even go to the VA. And so it's a whole panoply of bills. There's about 6 or 7 of them in this package. Now the Democrats will probably, oppose it now when they have some power to, but they will be reasserted next year. There's also really scary stuff about them reassessing what conditions will be compensated for and allow you and be deemed to be service connected, which will allow you to get access to VA care, whether in the private sector or the public sector. And this is really interesting. The veterans don't understand this because if you have to, in order to get government paid for care wherever it's delivered, you have to have a service connected disability, and the government has to say that this is a service connected disability. So if they say that PTSD is not a service connected disability, or some toxic exposure is not a service connected disability, these people won't be able to get health care anywhere.
Wow. So I just want to make absolutely crystal clear for listeners here that the conservative critique, so to speak, of the VA system is not substantive at all. It's purely ideological. Is that correct?
Yeah, no, I think it's not based on evidence, not based on research, it's not based on studies, it's not based on what's best for veterans themselves. It's not based on patient satisfaction surveys conducted within the VA, which generally show that most people are pretty happy with the first choice, which they'll lose if this fantasy that VA patients can go anywhere and the government will pay for it, because that is going to come to a crashing halt at some point. The other thing from a labor standpoint, I'd like to mention, this is a heavily unionized healthcare workforce, like Kaiser's. About 100,000 of the people who are caregivers at the VA are veterans themselves. You're not going to find that in private sector healthcare to the same degree, to say the least. And so it's an important kind of jobs program for people who've been in the military, who are now nurses and doctors and therapists and, all kinds of roles at VA hospitals and clinics. And that unusual aspect of their healthcare workforce is what creates a culture of solidarity and support, and what makes the VA a welcoming place for people who've been in the military. If you're being cared for by people who understand military culture and share the job experience, having been former service member, it's very different than being just randomly sent out to anybody who's going to be treating you on a fee-for-service basis and sending the bill to the federal government. So,
well, and I think that Steve raises an issue that I know is not the topic of this podcast, but the attack on public sector workers and federal workers is really an attack on veterans, because there's such a thing as veteran preference in hiring.
Yes.
And about a third of the federal workforce is veterans. So if you want to unemploy, I don't know what the total number is in federal government service, but at the VA, it's something like, in the Veterans Health Administration, it's almost 400,000 people. So if you want to, with a wave of a magic wand, send a whole bunch of people out into the streets with no health care and no benefits and so forth. This is the way to do it. And what you're going to see is an increase in veteran suicide, an increase in veteran homelessness. This is really an anti-veteran package, what he's proposing. And then not to mention cuts on Medicare and Medicaid and so forth. You do that, that's a triple whammy. These people aren't going to have access to health care anywhere.
But not to end on a totally gloomy note, when they get to the point of announcing facility closings, that is the point at which the veteran service organizations, the Legion, the Veterans of Foreign Wars, some of the better, smaller, more activist and progressive veterans groups, the VA unions, affected communities, patients and their families will mobilize. And they've done it in the past. And then even Republican members of the House and Senate, oh, no, we're for privatization. We're for outsourcing. Just don't close this clinic, this hospital, this part of the VA in my district or my state. Yes. And this happened under Biden. He had a very elaborate plan that would have had a devastating impact on the infrastructure of the VA early in his 4-year term. And it was blocked through a popular uprising around the country. Grassroots labor community coalitions formed. And that's going to happen again. So that is our last line of defense against the Republicans getting their way with the VA.
And even the Republicans turned against it, because suddenly, this person in this place that thought privatization.
John Thune has now got a big job in the Senate. He was one of the people that turned against this Biden facility closing plan because of how it was going to affect his state.
Well, it certainly seems like the time for mobilization has come, and hopefully we'll see that happen. Suzanne Gordon and Steve Early, thank you so much for joining us today.
Thank you so much.
Thanks for having us. It was great. Good to see you both.
That's it for this week from the Washington Monthly. I'm Ann Kim, and on behalf of my co-host, Garrett Epps, thank you for listening. If you like what you heard, don't forget to subscribe to our channel or wherever you get your podcasts. Have a wonderful week.